ஆமா இதாடி இதே வராது இப்போ ஆமா சார் இப்போ ஆமா
சுகந்தர் சார் ப்ரோக்ராம் லைவ்ல இருக்கு. உங்க ஸ்டூடெண்ட்ஸ் கொஞ்சம் ஜாயின் பண்ண சொல்லுங்க சார் யூடியூப்ல.
Good morning and namaste. We are live on YouTube. So now I request Professor Ravichandran, please proceed further towards the payment. Yeah.
Very good morning to all. We are going to shortly start the inaugural function of the village internship program. It is a novel initiative that has been designed by Unnat Abhiyan for involving the students in the community outreach program. Every higher education institution has a responsibility towards its community for its well-being and good health. In that context, this program is designed, and shortly we are going to inaugurate the program. We are going to place the medical students in UBA villages in the southern districts of Tamil Nadu. Right now, we have planned for placing the students in 100 villages. For that purpose, we have created network among the participating institutions of Unnat Abhiyan in the southern districts. And right now, they will start the program by conducting a village health survey. And based on that, they will diagnose the health issues that the population in rural area they face with the experts. And for collecting the data also, mobile application has been developed. So the students are involved in this process. The medical students are involved in this process. Then after collecting the data and diagnosing the health issues, students will design what sort of medical intervention is necessary. It may be an intervention at household level, or it may be an intervention in the form of medical camp, or the Saradakrishna Homeopathic Medical College, Kulasekharam, Kanyakumari district. They have developed a telemedicine system also, and we are going to use this telemedicine system to provide medical support, medical interventions for the affected people. So the program will be designed by the students, and in fact, they are also having the plan to visit the village schools, village youth group, village women self-help groups, and to discuss them. And wherever possible, they will design appropriate medical interventions. This is a 3-month program. Now, today we are going to inaugurate the program. We are waiting for the honorable chief guest of this day. Once they arrived, we will start the inaugural program. We request all the audience to be online, and it will be interesting session so that everyone can learn from the deliberations of this inaugural program. Thank you. Shortly, we are going to start the program. Please be online. One of our chief guest, Dr. Pinakin Trivedi, He is the President of Board of Ethics and Registration for Homeopathy, National Commission for Homeopathy, Ministry of Health, Government of India is joining. Sir, hearty welcome, sir. The Regional Coordinating Institute, Gandhigram Rural Institute, Gandhigram, deemed to be university, is organizing several programs under Unnat Bharat Abhiyan for the benefit of communities in our neighborhood. We are having 124 participating institutions in 11 districts of southern Tamil Nadu. They are having different capabilities, capacities, and they are trying to address various issues in their locality. And under the umbrella of Unnat Bharat Abhiyan, we have taken up self-employment opportunities program, health awareness program, awareness program on various government schemes and programs that are being implemented in this region by the government of Tamil Nadu and the government of India. So these programs are always going on, and we are also taking up training the faculty members who are involved in the Unnat Bharat Abhiyan program for carrying out the village outreach activities successfully. Yes, our honorable guest has come. Now we are with us the Director General NIRD, National Institute of Road Development and Panchayat Raj Institute in Hyderabad, and we are having with us Dr. Pinakin Trivedi, President, Board of Ethics and Registration for Homeopathy, National Commission for Homeopathy, Ministry of Health, Government of India, and Dr. R. Ramesh is subject expert group coordinator for convergence of Government of India schemes for Unnat Bharat Abhiyan. Hearty welcome, sir.
Thank you very much. Yeah.
Sir. Sir, shall we start the program, sir? DJ,
Yeah,
sir?
please,
Okay,
please.
Sir. Sir, Dr. Pinakin, sir? Okay, sir.
Yeah.
Yeah, sir. Thank you, sir. Thank you very much, sir. Very good morning to all. It is the inauguration program for the village internship program, which is carried out under the Unnat Bharat Abhiyan. Unnat Bharat Abhiyan is a flagship program of the Government of India, Ministry of Education. Indian Institute of Technology, Delhi is the national level coordinating institution. The Gandhigram Rural Institute, Gandhigram, is one of the regional coordinating institution under Unnat Bharat Abhiyan. Sir, India has given its strong commitment to the achievement of Global Sustainable Development Goals 2030. Goal number 3 is about good health and well-being. Actually, novel and innovative solutions are the domain of health care or need of the hour. In this context, the higher education institutions have the responsibility to instill among the students a sense of social responsibility and a community commitment to serve the rural community through innovative solutions to address the issues in good health and well-being. In this context, this program, Village Internship Program, is organized with the basic objective of enabling the medical students to comprehend and relate classroom learnings to field level realities through the identification of health issues and problems in UBA villages in southern Tamil Nadu and to provide affordable medical care services to the people. This program will be implemented in UBA villages in 11 districts of southern Tamil Nadu. For effective implementation of this program, committees are constituted at Saradakrishna Homeopathic Medical College. Their students are going to be involved in this program. It is expected that this program, among others, would enable the interns to develop an appreciation of rural culture, lifestyle, and wisdom, to understand the causes for distress in rural health and explore appropriate solutions for the same, to demonstrate the application of knowledge and skill sets acquired from the course of study in real life situations, and to provide appropriate medical interventions for rural health care in UB villages. In this context, on behalf of the Regional Coordinating Institute, Unnat Bharat Abhiyan, and the National Institute of Rural Development and Panchayat Raj, Hyderabad, and the Saradakrishna Homeopathy Medical College, Kulasekharam, Kanyakumari district, I welcome Dr. G. Narendra Kumar, IAS, Director General, National Institute of Rural Development and Panchayat Raj, for inaugurating this program. In near future, we have several other programs to be organized under Unnat Bharat Abhiyan jointly with the National Institute of Rural Development and Panchayat Raj. Sir, your presence and support will always be a hand-holding support for our institute, sir. Hearty welcome, sir. On behalf of the Regional Coordinating Institute, Unnat Bharat Abhiyan, Gandhigram Rural Institute, Gandhigram, and the National Institute of Rural Development, Hyderabad, and Saradakrishna Homeopathy Medical College, Kulasekharam, Kanyakumari district, I extend my warm welcome to Dr. Pinakin N. Trivedi, President, Board of Ethics and Registration for Homeopathy, National Commission for Homeopathy, Ministry of Ayush, Government of India, New Delhi, to deliver special letters. This program is specially designed for students of homeopathy, and definitely your presence would definitely motivate the students and the faculty members to carry out the programs most successfully, sir. Hearty welcome, sir. I extend my warm welcome to Dr. R. Ramesh. He is one of the subject expert group coordinator of the Unnat Bharat Abhiyan. Currently, he is a head CIPR, NIRD PR for associating with us, and he is helping us in designing and carrying out this program successfully. Sir, hearty welcome, sir. Further, I extend my warm welcome to the principal, UBA members, and the students of student interns of Saradakrishna Homeopathy Medical College, Kulasekharam, for taking up this challenge of organizing this village internship program during this pandemic period. I welcome all the members of UBA team Gandhigram for their continuous contribution to make all UBA programs more meaningful and relevant to the society. Once again, I extend my warm welcome to all the dignitaries and the stakeholders of this program. Now, before inviting our guest, Dr. G. Narendra Kumar IAS, I would like to introduce you to the information of the learned participants assembled here. Dr. G. Narendra Kumar IAS is a senior IAS officer of the Secretary Cadre at Government of India. He is currently the Director General of the National Institute of Rural Development and Panchayat Raj, Hyderabad, familiarly known as NIRD and PR. This institute is the think tank on rural development in India, working under the Ministry of Rural Development. Last week, we had a wonderful meeting for the UBA coordinator, regional level coordinators at NIRD. Dr. Narendra Kumar IAS previously served as Additional Chief Secretary in Delhi government. He was instrumental in setting up 4 universities in Delhi. Earlier, he worked in various national and international academic institutions such as Administrative Staff College of India and ICRISAT. We feel honored as he has accepted our invitation to be a part of this internship program. One of his recent initiatives at NIRD and PR is preparing quality Gram Panchayat development plan in 250 clusters of Gram Panchayat in several states of India. So with this brief introduction, now I invite Dr. Narendra Kumar IAS, the Director General of National Institute of Rural Development and Panchayat Hyderabad, to inaugurate the program and deliver the inaugural letters. Sir, please, sir.
Thank you very much, Dr. Ravichandran, and other distinguished guests who are present here today, Dr. Pinaki Trivedi, and the Dr. Ramesh, who is present here. Pinakin Trivedi, Dr. Ramesh, who is present here, Dr. Sugatan, speaking with Mr. Professor V.K. Vijaya. He said that he's unable to join here today, but all other distinguished guests who have joined this inaugural ceremony for the village internship program, and the students of the internship program, I extend a very warm welcome and a very good morning to you. It's indeed a very very, very laudable initiative taken by the Gandhigram University and by the Saradakrishna Homeopathic Medical College, Kulasekharam. And this I hear is being done in 11 districts of Tamil Nadu, which spans a very large area of Tamil Nadu. And it's a very laudable initiative, both for the students and for the rural community. And I'm particularly glad that this is being observed and done under the flagship of the Unnat Bharat Abhiyan, which is also a very, very important initiative of the government of India. I thought I'll paint for the students who may be listening in for this village internship programs orientation workshop on what broadly should be their approach to the village internship program. Of course, the detailing would be done by the coordinators, by the Gandhigram University, and by the Saradakrishna Homeopathic Medical College. From a rural development perspective, health is a very, very important determinant of the quality of life. It is an important determinant of quality of life for everyone, for that matter, be they in rural areas or be they in urban areas. But one of the key things about rural areas is health facilities are significantly deficient. And because of that, the cost that the rural citizens have to incur on healthcare expenses are disproportionately high compared to those living in the urban areas. The country as a whole, more than I think about 60% of the healthcare expenses come from the private sector, from the individuals themselves, and a smaller part comes from the public sector. Given this scenario, excessive healthcare expenditure drains out the resources of the rural citizens. And as a result, many of them slip into poverty. And it has been shown by many studies that the healthcare expenditure is the second important cause for people to slip into poverty. And once they slip into poverty, it takes generations for the people to be pulled out from the poverty trap. Not only because they are deprived of resources, but also because a mindset of fatalism creeps into people that they don't want to fight away the poverty. As a result, poverty-stricken families stay so in poverty for generations, several generations, and after several generations, somehow they lift themselves out of poverty and come out of it. It's therefore important to view the need for staying healthy to be preventing people from slipping into poverty. Healthcare provides immunity to people from slipping into poverty. That is also a significant aspect that needs to be kept in mind. Also, the COVID crisis has brought healthcare concerns, especially those in rural areas, to the forefront, in the sense that the first wave of COVID was essentially an urban phenomenon. People started migrating from urban areas to their farmhouses in rural areas in the belief that the COVID intensity is much less in rural areas, or hardly it is present. There is no COVID present in rural areas, was the thinking, because of people migrated to rural areas and stayed there in rural areas in a hearty and healthy manner during the COVID wave 1. But COVID wave 2 was different. The COVID wave 2, significant amount of rural areas were also infected with COVID. And substantial amount of COVID infections spread from the rural areas to the urban areas. So this divide in today's world of public health between urban areas and rural areas is artificial. So we have to provide good healthcare services both in the urban areas as well as the rural areas if we want to safeguard the health of even those in the urban areas. That's something that needs to be kept in mind. And taking this into consideration, NIRD has been striving hard to focus on improving the quality of life of citizens in rural areas, not merely providing them additional income sources or empowering them to utilize government facilities in a better manner, but make substantive changes to bring about an improvement in the quality of life of the rural citizens. And I now turn to the medical education as I have closely seen it in the past few years and continuing to see it, because two of my children are also in the medical education field. They're students studying, and what we've been noticing is that the difference between the doctors of the previous generation and the current generation is that many of the current generation doctors are specialized doctors, specialized in their field, super specialized in their field. They are doing very well as specialists, as super specialists. But when the super specialist is given a common day-to-day problem to solve, they fail. That's because the basic medical education ability to deal with common medical problems is missing in the doctors of today. And that is so because there is a lot of emphasis on theoretical education, a mad rush to get into PG seats and to go forward. Because of that, emphasis all along their medical education course curriculum, course period, is to look at the PG seat, which kind of PG seat I will land in, what branch I will land in, how I will do well as a PG doctor. They are not looking at how they can be good general practitioners. That's very, very necessary to understand the basics of medicine, medical science, and how the patients have to be treated. This aspect is missing in today's medical education, that they are not well-rounded doctors. The other thing that I have seen with one of my younger daughter, who is again in medical school, is that she keeps on studying. I mean, keeps on studying for almost 16, 17, 18 hours a day. We say, hard pressed to tell that girl that, look, you don't study so hard, you don't have to study so hard. It's okay, curriculum may be intensive, but it's not so much necessary. And so she wouldn't really listen to us. One of my friends came in, and friend's wife, who works in a prominent government medical college in Delhi, she came in and said that, look, why you have to struggle so much and be fearing that I failed the examinations? If you look at the statistics in the medical education system, now hardly anybody fails. More than 95 to 98% students pass the examinations. Earlier, it was not like this. And some of the students who are like my daughter, sincerely studying, they are lugging away at the studies and acquiring a lot of capabilities in the medical education. But many others pass without paying any due diligence, without putting in adequate efforts towards medical education, nor are they well trained to be general practitioners. This is the scenario of today's medical education, a very big dip in the quality of medical education and in their ability to provide effective services as a general practitioner. And that's where a program like the UBA comes in and can be very valuable to the medical students also. One internship, call it internship, conducted by the CMC Vellore, Christian Medical College Vellore. Christian Medical College Vellore does not allow its undergraduates to go to post-graduation unless they do 2 years of service or 2 years of internship, especially in rural areas. That's when they require the capabilities to become a thorough general practitioner. And that's how the institution is strong, with people of high caliber and capability. It is able to withstand the competition from so many government colleges, private colleges, and keep its rank high in the ranking of medical colleges in over several decades, because of the strong capabilities which are inculcated in the students through internship, in addition to good medical education that they go through. This shows the value of the internship to medical graduates and to their future career. Unnat Bharat Abhiyan recognizes these, I would say, distortions in the education system, wherein the students are not put through thorough and rigorous curriculum. They are not given a problem-solving approach. Focus is substantially on theoretical and rote learning, less on application. Whereas a doctor, a medical practitioner, has to deal with applications day in and day out. They have to treat patients. Theoretical knowledge itself will not suffice. So in that respect, Unnat Bharat Abhiyan also tries to foster a problem-solving approach to students and learning through problem solving. Being in the field, they are brought face to face with various problems and to find innovative solutions to the problems. And through that, we reinforce the community, we enforce the strength of the community and the strength of the students as well to be able to solve problems utilizing all the knowledge that they have learned in the medical college or in other higher education institutions. So in that direction, I'm glad that this internship spans 3 months, and I'm very sure and confident it will be a win-win both for the students and for the rural community, being conducted under the UBA's flagship and banner as a problem-solving approach, as a capstone to enable the students to apply all the knowledge that they've acquired in their medical college to practical problems in the rural areas. And there are many problems in the rural areas. As I was mentioning, the healthcare in rural areas is much neglected. If we look at the availability of doctors in rural areas, it is a fraction of the availability of primary healthcare doctors, of secondary healthcare doctors, of hospitals in rural areas compared to urban areas. Urban areas, there is access to medical facilities much more than in the rural areas. Because of that, even if a person has money, he cannot get healthcare services in rural areas. This is the problem. Typically, they talk about access to medical care, affordability, and quality of medical care. I must say that all three parameters, the rural healthcare is deficient, and that's what we should be reinforcing. And we talk about again the trinity in public healthcare indicators, that is an infant mortality rate, maternal mortality rate, and institutional delivery mechanisms, out of institution delivery. So in all three parameters, again, immunization rate, all these parameters, indicators, the rural areas are lagging behind, much defective still. And there's a lot of catching up to do on these parameters: infant mortality rate, maternal mortality rate, immunization, which goes to show that the public health care available in rural areas is also much lagging behind those in urban areas. And that's where contribution comes from the homeopathic doctors of this college, the Saradakrishna Homeopathic Medical College, to be able to uplift the rural folks in 11 districts of Tamil Nadu. And I would advise that you also please focus on the preventative aspects of healthcare, because food, especially, is a very important constituent of for determining health. Earlier times, people used to eat coarse grains, millets, which were rich in micronutrients and various nutrients. We spoiled the habits of people in rural areas by allowing them access to rice and wheat, and more or less the consumption pattern of food has now changed from millets, healthy food grains, to the unhealthy rice and wheat, relatively unhealthy wheat and rice, which are deficient in calcium, which are deficient in micronutrients, and so on. Now the wheel has turned full circle. People in urban areas are going back to millets and to the coarse grains. So we have to educate the people in rural areas what food they were traditionally eating is healthy. People believe that it is unfashionable to eat those things. Those myths have to be debunked to say that what you've been doing traditionally is a healthy practice. Please continue to do that. That's all that needs to be conveyed to people. Similarly, the other public health infrastructure also needs to be effectively taken care of. We have to ensure, like there have been many studies to say that malaria has incidence is much reduced if you just have mosquito nets, and especially insect repellent laced mosquito nets. So such like simple practices prevent a lot of healthcare incidents and lot of expenditure on the healthcare costs. So those preventative aspects have to be brought to the fore for the rural folk and the rural community. In addition, I'm glad that this village internship program is intending to conduct a health survey to understand the problems of various diseases in different villages, because there are many diseases which are endemic in villages, and there is need for specific focus for those endemic diseases. Some, there may be much incidence of filaria. In some cases, there may be incidence of diabetes for whatever reason. So those endemic diseases have to be dealt with through special treatment, through special clinics. So the health survey will bring to focus the different kinds of diseases which are prevailing in the villages, and how to effectively deal with those endemic diseases. I'm also glad that we are looking at providing health services at the household level and also organizing medical camps. Both are very important, because a medical camp, we can have a specialized treatment, and we can try to bring people from the faraway parts of the village to the medical camp, treat them effectively, see that they become healthy. Also very heartening for me is that the Saradakrishna Homeopathic Medical College has a telemedicine facility. This is the future of health and healthcare in India and anywhere in the world. And I'll say this from our experiences during the COVID time, because all the doctors switched to telemedicine video consultation. Almost all doctors switched over to video consultation during the COVID time. Earlier, they said, no, I have to see the patient. Without seeing the patient, I can't treat. But that went away, the toss, and they said, no, video consultation is order, because my security is important. And with video consultation, they got along very well. The treatments took place, and patients also, I think, got cured quite effectively. Reinforcing that mechanism, now we can take telemedicine medical care to almost all villages of the country. We can take the services of leading healthcare experts, including leading homeopathy practitioners, to the villages. And I'm therefore very glad that the Saradakrishna Homeopathic Medical College has the telemedicine facility, and I request them to make available this telemedicine facility as a part of this village internship program, and provide effective health care to the villages and effective care of their experts to the villages. And as I was mentioning, this internship program, I'm very confident will be for the students, for the college, as well as for the rural citizens. And this is the way to go forward, to move forward under the banner of UBA, adopt a problem-solving approach, adopt an approach to deal with the particular problems in rural areas, at the same time learn very substantially from it. I wish the students and the college, as well as the Gandhigram Medical University, all the very best. Thank you so much.
Thank you, sir. Thank you for sparing your valuable time amidst a tight schedule of programs for delivering inaugural address and inaugurating the program. Sir, for your kind information, we are shortly going to have a program for aspirational district, as well as our team visited a rural technology park at NIRD. Based on that, Saradakrishna Homeopathy Medical College and other colleges, other two colleges, now they are preparing for developing rural technology park in their institutions. So once things are getting ready, we will communicate to you, sir, and we will request you to come personally and inaugurate the program, sir. Thank you. And this program, Village Internship Program, is being organized in collaboration with the NIRD. We are happy about it, sir. Thank you very much, sir. Thank you very much. Now, I would like to invite Dr. Pinakin N. Trivedi. A few words about Dr. Pinakin N. Trivedi. He served as a principal of Homeopathy College in Gujarat. He also served at several responsibilities, positions at Central Council of Homeopathy. Currently, he is the President Board of Ethics Registration for Homeopathy, National Commission for Homeopathy, Ministry of Vice, Government of India, New Delhi. Sir, on behalf of Unnat Bharat Abhiyan, once again I extend my warm welcome to you, sir. Gandhigram Rural Institute, Gandhigram, and Saradakrishna Homeopathy Medical College, in collaboration with the National Institute of Rural Development and Panchayat Raj Hyderabad, has prepared this innovative rural intensive village intensive program with your blessings. Our young students will definitely will learn a lot of things in taking homeopathy medicines and medical support to the UBA villages in southern Tamil Nadu, sir. With these few words, once again, I extend my warm welcome and please, sir. Sir, your audio, please.
Thank you, Dr. Ravichandran.
Thank you, sir.
All privileged dignitaries, Dr. G. Narendra Kumar ji, Dr. Professor V.K. Vijay ji, Mr. Dr. Sugandhan, my dear expertise faculties and budding homeopaths. I am glad to be a part of the Azadi-Ka Amrit Mahotsav Unnat Bharat Abhiyan village internship program arranged by Saradakrishna Homeopathic Medical College, Kulasekharam, along with NIRDP Hyderabad, UBA, and Gandhigram Rural Institute, Gandhigram University. As such, this is an unique program arranged by our Saradakrishna Homeopathic Medical College, as we are all engaged here to look forward to succeed for an achievement of Sustainable Development Goals 2030 in the field of health and well-being. Incorporating such program in internship of budding homeopaths with the sense of development of social responsibility in students and service rather of the society may develop in the students attending such type of internship and innovative programs. Government of India has also coined a word health for all to facilitate the access of primary health care for every individual. As such, in rural area, the training of internship will develop the sense of services, medical services required to an individual staying in the rural areas. And Government of India also endeavors this year Azadi-Ka Amrit Mahotsav to inculcate the involvement of all Ayush colleges, and all have shown absolute response. All Ayush colleges have shown absolute response and imparted this endeavor. Especially, I would like to put stress upon the homeopathic colleges. The machineries through homeopathic colleges has mobilized to boomed all the activities, and I am proud to inform on this stage that the homeopathic stream is leading among all Ayush system in activities during Azadi-Ka Amrit Mahotsav. So we are in the need of expertise feedback of this precious outcome of this program. It is an out-of-box combination experiment of different government programs of different ministries. You have included the state ministries, the university, the UBA, and NIRDP, along with the homeopathy, the manpower which is supplied to this make possible the efforts is our homeopaths. So I appreciate the effort of Saradakrishna Homeopathic Medical College for their involvement in all national health Ayush program. congratulating every homeopathic fraternity, wishing you all the success to the buddy homeopaths. Thank you very much.
Thank you, sir, for your valuable presence and address to the program. Sir, for your kind information, I forgot to say one thing that recently under this Agasiya Amaruchu Magasho, we have conducted 100 school students, village schools, homeopathic medical awareness program in this
Yes.
COVID pandemic period, sir. And we are also having the plan to have a community outreach centers in southern Tamil Nadu. If National Commission is supporting us, definitely we will have community outreach centers that will have more interface between the medical students and the villagers. So as our Director General NARD pointed out, we will take the medical support to the needy people in the village centers. So for that purpose, we would like to have community outreach in the southern Tamil Nadu, sir. We request your support, sir.
No, it's it's forever. And being a less number of colleges, homeopathy colleges among Ayush system, we are leading in the program of Azadi-Ka Mahotsav. That I wanted to inform you.
Yes, sir. Yes, sir. Yes, sir.
Okay.
Thank you, sir.
It's-
Thank you very much, sir. Thank you very much.
It's only because of the efforts of such colleges, such institutions, that
Yes, sir.
homeopathy is leading Ayush in this Azadi-Ka Mahotsav. So
Yes, sir.
I am supposed to be thankful to the institutions like you.
Okay,
Thank
sir.
you.
So this is a network from among the this university, NIRD, as well as 11 colleges we have identified in 11 districts. So we are going to develop MOU with these colleges also. So this program will continue hereafter. So like this arrangement has been made, sir.
So I have used the word of out of box.
Yes, sir. Yes, sir.
It is an innovative program, a combination, well combination, and it will definitely have very good end results.
Yes, sir. Thank you, sir. Thank you. With your blessings, definitely we will get good results for this program, sir.
Thank you very much.
Now I request.
Thank you for inviting me.
Yes, sir. Now I request Dr. N.V. Sugandhan, the coordinator, Unnat Bharat Abhiyan, as well as principal Homeopathy Medical College, Kulasekharam, Kanyakumari district, to propose vote of thanks. Sir, Dr. Sugandhan, sir, please, sir. Sir, your audio, please.
You need to unmute.
Sir,
Yes.
Sir, good
Please.
morning.
Yeah.
Good morning, sir. Sir, India has given its strong commitment to the achievement of global sustainable development goal into 2030. The goal 3 above is about the good health and well-being. Considering the importance of this goal, the UBA, the unit of Saradakrishna Homeopathic Medical College, has planned to conduct a village internship program to find innovative solutions in the domain of healthcare for benefit of students as well as the villages in southern Tamil Nadu. This program has been planned to be implemented in 100 villages in 11 districts of southern Tamil Nadu from December 21 to February 2022. For effective implementation of this program, the committees are constituted at various levels at our college level as well as the regional coordinating institute level. We have also sought support from the health department, government of Tamil Nadu to carry out the program successfully. In this context, on behalf of Unnat Bharat Abhiyan, we extend our sincere thanks to the Vice Chancellor, Registrar, and the authorities of the Regional Coordinating Institute, the Gandhigram Institute, the deemed to be university, the Gandhigram, for facilitating us to implement this program. We extend our sincere thanks to Dr. Narendra Kumar IAS, Director General, National Institute of Rural Development and Panchayati Raj, for inaugurating this program. Sir, your presence and support is the motivation for our students and faculty members. Thank you, sir. Next, we thank to Dr. Pinakin and Trivedi, the President of Board of Ethics and Registration for Homeopathy, National Commission for Homeopathy, Ministry of Ayush, Government of India. He is formerly the Central Council of Homeopathy member also, and he is worked in the survey in various committees in the previously in the Central Council of Homeopathy in New Delhi. For delivering the special address in this inaugural program. This program is especially designed for students of homeopathy, and hence your presence definitely motivate the students and faculty members to carry out the program successfully, sir.
Thank you.
We thank Dr. Professor V.K. Vijay, National Coordinator, Unnat Bharat Abhiyan, National Coordinating Institute, CRDT, IIT, Delhi, for his continuous support and motivation to carry out the various UBA programs in our college. But unfortunately, he is not present here, but he is constantly supporting this type of programs and motivating in our institute for this type. We are already provide a lot of projects also submitting to IIT through UBA. I would like to state that the regional coordinating institute, Gandhigram should provide us handholding support to make all our UBA programs in grand success. Also, we thank UBA team members at National Coordinating Institute for this continuous technical support during our UBA program. Thank you, sir. Further, we extend our sincere thanks to the principal and the UBA coordinator for participating institutes in these 11 districts who are going to support our students for village internship program. We thank all those students, interns, faculty members of Saradakrishna Homeopathic Medical College, Kulasekharam, for taking up the challenge of organizing village internship program under Unnat Bharat Abhiyan with the support of the Regional Coordinating Institute. Finally, we thank Dr. K. Ravichandran, the Regional Coordinator, and all the UBA members of UBA team, Gandhigram, for their continuous contribution to make all Unnat Bharat Abhiyan programs of our college more meaningful and relevant to the society. Thank you, sir. Thank you.
Thank you.
Thank you, sir. Thank you for joining with us and inaugurating the program, sir. The formal inauguration has come to end, and in Google Meet we are going to have 2-day orientation work for the students. So the students will have a theoretical background on how they have to carry out the village internship program. So that will start by 11 o'clock. So thank you, sir. Thank you for joining.
Thank you.
Thank you, sir. Thank you, sir. Rahul Ji.
Yes. Thank you.
Thank you. Thank you.
I'm
Thank you.
just winding up.